Okay, just want to welcome y'all here today. Want to go over the summary of benefits for the Humana HMO plan for 2022. So you can get a copy of this from our website, or maybe we gave you one when we met, or we mailed you one. Either way, follow along with me because I'm going to bring it up on the screen. The 2022 benefits for the Humana HMO plan in North Carolina, Western North Carolina. So here's our summary of benefits 2022. Plan H6622-025. All right, here we go. So these are the counties where this is available. Most of the Western North Carolina counties, you probably see the county where you live right there. And if you don't, let me know, okay? If that's not your county and you're watching this video. So let's talk about the Gold Plus plan. To be eligible, you have to have Medicare A and enrolled in Medicare B and live in the service area, which is those counties that I just shown you, which is most of Western North Carolina counties. And there's phone numbers, of course, for calling Humana. And you're going to have all this. So let's go over the copays and premiums and everything. First of all, monthly premium is $0. You, of course, pay your Medicare Part B premium, which is $148.50 in 2021. It'll probably be a few dollars more in 2022, but we don't have that data at the time of this recording. But it usually goes up a few dollars every year. But you pay $0 premium in addition to that. No premium whatsoever. Medicare covers this for you. There is no deductible for the medical portion of the plan. There is a $150 deductible on Part D, the drug coverage, but that's only for Tier 4 and 5, which is non-preferred drugs on Tier 4 and specialty drugs on Tier 5. All right. So max out of pocket, $5,900. That's the most you would pay for copays and co-insurance. What does that mean? Max out of pocket is the most, the cap. That does not mean deductible. It starts paying from the very first doctor or office visit or anything. It starts paying and you have a copay, but you max out at $5,900. In other words, unlike Medicare, which 20% you have to pay on Medicare with no limits, there's no cap to the 20%. Here you have a cap. So at least you won't be totally financially ruined, because although $5,900 is a lot of money, it's better than infinity with Medicare alone. Okay, makes sense. Let's see. So hospital benefits, $395 a day for the first 5 days in the hospital. $395 a day for the first 5 days in the hospital. So even if the bill's $500,000, you're going to pay $395 a day up to 5 days and no copay after the 5th day. What does that cover? The room and board, the doctor, the surgeon, the anesthesiologist, intensive care, everything. $395 a day for 5 days. That's all you'll pay. Incredible. That's all that you would have to pay. Outpatient coverages, like an outpatient surgery at the hospital, $395. At an outpatient ambulatory surgical center, like your doctor's office, $345. Doctor visits, $0 for your family doctor, your primary care doctor, $45 for specialists. Of course, these days, most everybody's a specialist, so $45. Here's something that you need to know. It is an HMO plan. We do have a very strong network here in Western North Carolina for this plan. But watch this. You do not need a referral to receive covered services from a plan provider. So if you want to go straight to your eye doctor, skin doctor, foot doctor, knee doctor, any specialist that you want to go to, you do not have to go to your family doctor and get a referral to go to the specialist. Just go straight to the specialist of your choosing. Pretty cool. So a lot of HMOs do require that. You have to go to your doctor first to get a referral. This one does not. Very different than a lot of HMOs. So covered medical and hospital benefits. These are preventative care things. Everything from alcohol misuse, bone mass measurement, breast cancer screening, cardiovascular disease, PSA tests, HIV screening, tobacco use cessation counseling, all kinds of the routine physical exam, Medicare diabetes prevention program, all kinds of preventative screenings at no cost to you, $0. Pretty cool. Emergency room, $90 copay. If you're admitted within 24 hours, they waive the $90 copay if you're admitted to the hospital. Urgent care, $35 at an urgent care center. Then you've got diagnostic care and services. You can see some of these say 45 to 75 copay. I always like to err on the high side and say it's probably going to be the 75. So that's mammography, radiology services, lab services. Here we know the difference is $0 lab cost if you go to a freestanding lab like Quest Diagnostics or LabCorp. We always recommend those too. The doctors offices that use the hospital, or if the labs are in and through the hospital, it's a $50 copay. So often people get a prescription for what they need lab work done, take it to Quest Diagnostics or LabCorp, and the copay will be $0. That's just a tip for you there. Diagnostic testing and procedures, $95, x-rays, $110, radiation therapy, $45 or 20% of the cost. So those are your outpatient care services. Hearing tests, $45. How does hearing aids work with Humana? Yes, there is hearing aid coverage, but like a lot of Medicare Advantage plans, you see a lot on TV commercials, we're going to give you hearing aids. Not so fast. Yes, there is a hearing aid, $6.99 for advanced level hearing aid, one per year, $9.99 copay for a premium level hearing aid. But I'm just going to tell you straight up. My dad has Humana. He went to get hearing aids. He wanted something that connected Bluetooth to his phone. He didn't get any money for it because this is going to cover pretty much more of a baseline model hearing aid. If that's good enough for you, more power to you. Get the hearing aid. So, but if it's not, I'm just honest. I don't sell this plan based on we're going to give you free hearing aids because it's not going to cover a lot on hearing aids, but it does cover some. So people are asking me all the time, does it cover hearing aids? And if you get those hearing aids, 80 batteries, extended warranty, trial periods, these kind of things. Here's the dental. This is pretty good. Dental 171 is what I want to focus on. You can see all these zero copays for x-rays and bite wings and adjustments and dentures and root canals and crowns and all these kind of things. Look here, $2,000 combined maximum benefit per year for preventative and comprehensive benefits. We have found that bridges are not covered, but pretty much everything else, if it's not cosmetic, is covered up to $2,000 a year. Now, the question is there a network? Yes. Do you have to use the network? No, you don't have to stay in the network. Very few dentists in Western North Carolina are actually in this network. And that's because it doesn't honestly reimburse the dentist that much, so they really don't like it. But you can go to a dentist that's out of the network. Most of the time, they'll file it for you if they want, get an itemized receipt, mail it to the address on the back of your Humana card, and they'll send the money from Humana straight to you for the claim. Okay. So is it going to cover as good out of network as in network? No. A lot of people don't want to change their dentist though. So here's how we look at it. If you have $1,000 bill and it only pays 500 of it, okay, you may be a little bit upset, but here's how you look at that. At least it paid 500. You didn't pay for this dental coverage. Nothing's coming out of your pocket in terms of premium. There's no waiting period. It covers all of these things and you got $500. Before you had this plan, if you didn't have dental insurance at all, you got zero. You paid the whole $1,000. So at least we're paying something. That's kind of how I want you to look at this, guys. The glass is half full versus the glass is completely empty. So if you look at it like that and you realize, hey, I'm not paying anything. And yes, it didn't pay a whole lot. It only paid half the bill or maybe less, maybe more. It's going to pay more if you go in network. So if you want to find an in-network dentist, call Humana. They'll tell you based on your zip code, the closest in-network dentist, if you don't mind changing dentists, and it'll pay a higher percentage. But again, I just love to be honest with my people and say, hey, it's a great benefit. It's not perfect though, but it's better than not having it. And 2022 will be our second year with this plan. And we've seen many, many people get a whole bunch of money for free because of the dental benefits on this plan. So get excited about that. All right, this is more listing out of all the copays that it does, which you see are all zero there. So vision, $45 copay for vision copay, diabetic exams, glaucoma, Medicare covered eyewear, 000. Now the post cataract is Medicare covered eyewear. So if you get cataract surgery, you need to get glasses afterwards. They're going to give you a pair of glasses, but it's not going to be the top end model, wireless, frameless kind of glasses, transitions, all that stuff. Progressive, all those lenses. It's not going to be that. It's going to be pretty much a basic pair. But again, at least it's something that Medicare covers after cataract surgery. No copay for that. So continuing on with vision exam, here you go, $100 for glasses or contacts per year. Now, this is a network called iMed, and it's not a very wide network. In fact, Lens Crafters is the main place around here that uses the iMed network. So your local eye doctor may not use it, but if you go to a place out of network, there is a form that you can fill out, call us and we'll send it to you so that you can still get your $100 per year for glasses or contacts, even if you go out of the network, out of the iMed network for the glasses. Mental health services, $395 copay for the first 4 days if you go to a mental health hospital. Outpatient group and individual therapies, $40 to $95 copay. Skilled nursing facility. Now, this is not your long-term care. This is you break a hip, you have a knee replacement, you're going to go to rehab. Most people are there for a few days to a week to 2 to 3 weeks, and then you go home, which is where you'd rather be, right? At home. But zero copay for the first 20 days, $188 copay days 21 through 52. And of course, this is subject to the max out of pocket. If you reach the max out of pocket, you're done paying. All right. Then no copay for days 53 through 100. Medicare's copay for days 1 to 20 is zero. For days 21 through 100, it's around $180 something per day. I don't know the 2022 numbers yet, but it'll be about the same as this. But they are covering at that copay for days 21 through 100. This is days 21 through 52. So a little bit better than Medicare's coverage on skilled nursing facility. Physical therapy, $10 to $40. Again, physical therapy at an outpatient freestanding office versus a hospital setting, $10 to $40. Ambulance, $290. Listen, my understanding is this includes helicopter, air ambulance this year, $290. That's amazing. Transportation, zero copay for 24 one-way trips to the doctor. Wow, 24 one-way trips. You say, well, how am I get home? Well, 24 one-way or 12 round trips, because you can get a trip home too. So you say, well, I don't need that. I can drive. Not if you break your right foot. You won't be driving. Or as we all get older, the ability of people to drive as you get older kind of tends to diminish. So there you go. 24 one-way or 12 round trips to the doctor for free. Transportation benefit. Pretty cool. Drug benefits. Part B drugs. Now, these are like chemotherapy or other drugs administered in the doctor's office, like infusion therapy, is 20% of the cost of those drugs. Then if you don't get the extra help program, and if you have a lower income and lower savings and you have only one house or you rent, you might qualify for extra help called Department of Social Services in your county, DSS. They can tell you the amounts of income that you can have to qualify for extra help. And many people do. It's a great program through the Social Security Administration. But other than that, there's a $150 deductible, but only for tiers 4 and 5. No deductible for generic tier 1, generic tier 2, and name brands. No deductible. Pretty cool. Then it talks about the deductible phase. So if you've used Humana before, you're probably familiar with these copays. They are very similar to years in the past. Most people love this. Tier 1 and tier 2 generics through the mail order, 90-day supply, zero copay. Look at that. If you're not used to doing mail order for your generic stuff that you have, a blood pressure, cholesterol, some of those basics, boy, that 90-day mail order is awesome. So no copay for that. You can see your copay for the different tiers that you have here, retail and mail order. Retail meaning a store. Standard cost sharing, again, this is for standard pharmacy, but you're going to use the mail order, the Humana's mail order pharmacy. So go back up to there, Humana pharmacy for your mail order. That's where you're going to get the zero copay. Okay. So let's see. Then this gets into 30 and 90-day supply. This is if you have the extra help that we talked about, $1.35, $3.95 is some of your max copays on 30-day supply. If you qualify for the extra help, again, called DSS, to ask about that. ISP, Insulin Savings Program, Insulin Savings Program. This plan participates in that. And the way that works is you can get certain insulins if you're diabetic, type 1 diabetic, 30-day supply for $35, 30-day supply all year long. Not subject to deductible, not subject to the coverage gap, otherwise known as the donut hole, $35 all year long. So this is an insulin supply program, insulin savings program is what it's called, ISP. This plan participates in that, which is phenomenal. Not all Medicare Advantage plans participate in that, but this one does. So let's look here. The coverage gaps goes up to $7,050, and then you're out of the coverage gap that don't hold back into catastrophic coverage. So there you go on that. Won't get into too many details. So here's some additional benefits. Medicare covered foot care, podiatry, $45. Chiropractic visits, $20. Medicare, medical equipment and supplies. These are durable medical equipment things like wheelchairs and oxygen, 20% of the cost. Medical supplies, 20%. Prosthetic. Look at this, diabetic monitoring supplies, zero copay or 10 to 20%. Well, zero copay is when you use the Humana pharmacy for the diabetic supplies. So like test strips, lancets, things like that, durable medical equipment for diabetics. Most people I've talked to are very happy with this program, zero copay for your diabetic supplies. Rehab services, $10 to $40. Again, $10 like in a doctor's office or freestanding, $40 copay if you go to something associated with the hospital. I encourage people to learn what they're teaching you and go to your Silver Sneakers gym. Maybe you can do the therapy yourself once they've taught you how to do it. And that's not possible for everything, but that is possible with some things. And you do have a gym membership. Everybody has Silver Sneakers. We'll talk about that in a second. Telehealth services. You know, a lot of people, because of coronavirus, don't want to go to the doctor's office. You can use your telephone and see the doctor, call your doctor up on the telehealth services. Zero copay for primary care doctor, $45 for specialists, urgent care zero, substance abuse, behavioral health services, zero copay. All right, extra benefits, corona testing and treatment. Of course, everybody's giving that away for free at this time. Silver Sneakers program, over 15,000 gyms around the country. Call Silver Sneakers or go silversneakers.com website. Put in your zip code. They'll tell you the nearest gym to you that has Silver Sneakers for free. Many of them have swimming pools, free classes, water aerobics, all kinds of fun stuff for seniors at the gym. It's a great place to go when it gets cold and rainy outside in the wintertime. Humana Well-Dine Meal Program. When you come out of a hospital stay or a nursing rehab stay, they're going to drop ship to you 10 frozen meals, 10 meals delivered to your door, no cost to you, so that you can recuperate without having to worry about cooking. Or maybe your caregiver who cooks for you, they don't have to worry about cooking, so they can focus more on giving you the care that you need. So that's a pretty cool program. Then this is a new thing, special supplemental benefits for chronically ill people, worry-free meals. What is chronically ill? Chronic obstructive pulmonary disease, COPD, diabetes, congestive heart failure, depression, or several other things that are managed by a management service. You can meet program criteria. So you have to call Humana to see if you qualify, if you're diabetic or COPD. Call and ask if you would qualify for this. So you receive 2 meals a day, every day for 12 weeks. That's 168 meals. And you can possibly qualify for an additional 12 weeks, 168 meals each cycle, delivered to you, no cost, so that you can maintain and get well and continue on with life, hopefully more normal through a chronic disease. Over-the-counter catalog, like last year, it was $15 every 3 months, every quarter, but it does carry over to the next quarter, any unused funds to the end of the year. So if you don't use it your first quarter, January, February, March, you're 15, you can use $30 or whatever's unused from the first quarter in the second quarter. So it does carry over to the end of the year. So you could use it all at the end of the year, which would be what, $60. So that's a pretty cool benefit. Band-Aids, Tylenol, Advils, toothbrush, toothpaste, vitamins, all kind of things that everybody has to go to the grocery store or the convenience store, or the drugstore to buy. All that $15 per quarter for free. Go 365, fantastic program. When you do your health screening services like your PSA test, your mammogram test, when you do wellness activities like going to the gym for Silver Sneakers or taking certain classes, you get points. Those points you can redeem for rewards like gift cards to restaurants and gas stations and all different kind of things. So it accumulates through the year. It expires at the end of the year. So usually I say call about October, November, certainly by December at the latest. Say, how many points do I have on Go 365? What can I get for it? And they give you free stuff. It's an incentive to do your healthy test screenings, your preventative test screenings, to be healthy and go to the gym and work out, do those kinds of things. So you can find out more about the drugs and the providers on the Humana's website search engine. And this is the legal disclaimer stuff. If you speak any of these languages, we can get you this stuff in those languages. And there's a place for writing notes at the end. So that being said, let me come back here to full screen and just say, hey, thank you for listening. I know that was kind of lengthy, but we appreciate you. We appreciate your friendship, your business, your loyalty for many, many years, some of you. And we hope that if there's anything that comes up, you have a question, you call us 828-648-9984, 648-9984. That's our office number. One of the girls will answer, or if we're on the phone or doing an appointment, it's often that we're busy, we'll call you back. And if you don't have a magnet on your refrigerator, call us and we'll send you one, because you should have a magnet on the refrigerator so you can keep our number easy at hand. Okay. Appreciate you guys. Have a great day.